You're in the park and you hear someone yell help. But by the time you get to them, they're unresponsive and don't have a pulse. What are you going to do? There are many crazy things that happen in the world today, and yet still a small number of people know how to save a life by doing CPR. Every second is crucial when it comes to saving a life. In fact, if CPR is done in the first few minutes of cardiac arrest, the person has 2 to 3 times the survival rate of a person that doesn't get CPR. And that is by the CPR facts and stats from the American Heart Association. So how are we going to do CPR? First, you assess the situation. Is the person responsive? Do they have a pulse? What does the environment look like? And is there something hard behind their torso in case CPR needs to be done? Next, if someone else is around, assign them to call 911. They will be the rescue breather after the call is made. But if you are alone, put the phone on speaker and begin compressions. These need to be started pronto. Kneel next to the person's torso and head, placing the heel of one hand in between the chest, right between the nipples. The other hand is sandwiched over the other. Your shoulders are up, you're on your knees, and your shoulders will be over top of your hands. In CPR position, just like this picture I have for you. And this is from the Appendix A Reference Tables, Conversions, Charts, and First Aid by F.A. Davis PT Collections. You will begin doing compressions, pushing down at least 2 inches, and at a rate of 100 to 120 compressions a minute, counting aloud. After 30 compressions, stop and assess if the patient is breathing. If they are breathing, great. Continue compressions. If they aren't, pull up the chin, opening up the airway, plug the nose, and do 2 rescue breaths. Each rescue breath should be about a second long. And I have a picture of this rescue position. And this is from the CPR Adult and Child 9 years and older from the Cruzy Hospital. Next, continue the cycle. 30 compressions for 2 rescue breaths. 30 compressions for 2 rescue breaths. Continue this cycle until help arrives. If help arrives, begin doing a 2-person CPR. Or if you start with 2 people, the caller of 911 will be the rescue breather to start. Same thing as the first person. 30 compressions for 2 rescue breaths. 30 compressions for 2 rescue breaths. After a few cycles, switch. This allows for quality compressions, so neither one of you get tired. Remember, quality compressions save lives. And none of us hope we ever have to do CPR. But in case we do, we will know how to do it. If it ever comes to the chance that you have to do CPR, get yourself to relax and think logically about the steps in doing quality CPR. The biggest thing to remember when doing CPR is CPR doesn't always save lives, but it does give the person a chance at survival.